Gynecological cancers affect thousands of women every year. What are the main causes of irregular periods?
This can be because of some of the, you can say, the abnormal hormonal conditions.
That is period pain normal?
If suppose the dysmenorrhea becomes severe, that means there is some kind of the problem within the uterus or in the cervix. And obesity can be correlated well with that of the PCOD.
Well, what is cervical cancer? How common is it among women nowadays?
In our country, about 1,27,000 women are diagnosed of the cervical cancer every year. And in about, say, 80,000 of the women, the death is because of this cervical cancer. The HPV vaccine is the primary prevention of cervical cancer.
Stress and lack of sleep, does that also affect women's hormones? Do papaya and pineapple always harm pregnancy? Does the HPV vaccine completely eliminate the risk of cervical cancer? Hello and welcome to India TV. I am Shivangi and you are watching Health DNA. Gynecological cancers affect thousands of women every year, but early detection can make all the difference. Joining us to talk about prevention and treatment is Dr. Rama Joshi, Chairman of Gynae Oncology and Robotic Surgery at Fortis Hospital. Ma'am, welcome to India TV.
Thank you.
Ma'am, let's first talk about some gynecological issues that are very common. So I want to first ask you that what are these most common gynecological problems that you see in women nowadays?
The most common gynecological problems basically are related with that of the menstruation, that is menstrual irregularities, or they can come up with that of any kind of the abnormal vaginal discharges.
Okay.
There can be discomfort or the swelling of the abdomen and dyspepsia. Dyspepsia is another symptom which can be correlated with that of the otherwise gastrointestinal tract, right? One is having some kind of abnormal GI, so they are having dyspepsia with that of bloating sensation or any kind of the distension in the abdomen. And also the dysmenorrhea. These are the general problems which women come across.
And these are mostly related to menstrual cycle. I was also about to come on to that as well, because periods, menstrual cycle is, our major concern. So my next question is, what are the main causes of irregular periods? Because that is also one of the most common things.
Yeah. Irregular period, whenever it is there, the most problematic situation is that the woman understands that this irregularity can be because of rather ignores it.
Yeah.
She doesn't even say, okay, fine, this time the period was at this moment, this time has delayed or it has come early. So why it has come early, she never actually concentrates on that, and she just, ignores it. So what happens that this irregularity can be increased. So irregularity, when it is persisting, then one should think that there can be some kind of the abnormality why it is happening. So now this can be because of some of the, you can say, the abnormal hormonal conditions, or it can be because of the reason of some kind of, you can say, the abnormality which is there in the cervix and the vagina or in the uterus itself. It depends on what age the patient is coming to us with that of the menstrual irregularity. If the woman is coming to us in the reproductive age group, where the woman is comparatively younger age group, we have to understand whether her cervical health and vaginal health is good or not. This can be, one of the presenting symptom of even the cervical cancer.
Right.
Or when it comes into the postmenopausal age group, most of the time this symptom can be because of the uterine malignancy or the uterine cancer. Sometimes there can be maybe the uterine endometrial hyperplasias. So these are abnormalities, and it can be because of all these, but these are really, to be considered that yes, they should have to go for the checkup, so that they know what is the reason for this irregular bleeding.
So if there is consistently a pattern that we see, then we need to get checked, right?
Sure.
That's what you are trying to inform.
Sure.
Also, ma'am, period pain. Many people have this question that is period pain normal, or also can it be a sign of a health problem, a bigger health problem? Is that also true?
Yeah, very true. Period pain can be, normally also the one woman can get the period pain. Now, this is mainly because you can say that it is the activity of the uterus during the period in which actually the uterus expels whatever the endometrial lining along with that of the blood. And
Right.
this is hormone related. And why it happens is mainly because of some kind of the prostaglandins they are being produced, and that these are painful. But usually this pain occurs a day or two before the period, and it usually subsides, very soon, maybe after a day or two after the period.
Okay.
So within 72 hours, it goes away. If the pattern is the same and it responds to that of any of the NSAIDs, I don't think so there is anything to be worried about.
Okay.
But if suppose the dysmenorrhea becomes severe, in severity, and also it is coming with that of for the longer duration, or it is persisting, it never goes off. I mean to say the patient is having the complaint of the dysmenorrhea, it actually reduces but it never goes off. That means there is some kind of the problem within the uterus or in the cervix. There can be either some kind of the lesion in the form of, say, the fibroid,
Okay.
or it can be the adenomyosis, or other than this, there can be intrauterine, some kind of the space occupying lesion, means there can be some kind of the abnormality within the uterus itself. Okay. So these are the women who require to really go for the checkup to understand why this dysmenorrhea is.
Okay. And also one thing related to periods is PCOD, PCOS cases. Why are these cases increasing so rapidly these days? Because we often see many more women are coming, explaining and informing that they are dealing with PCOS, PCOD. So why are these cases increasing?
Actually, PCOD occurs, in 1/3 of the young girls or the young women.
Okay.
So the cases are already there, but they are being diagnosed more.
Okay, so that's the main concern.
Yeah, it is because of that we have a feeling that yes, these are increasing. On the other side, yes, there is an increase. But why it is so? Because the obesity problem is increasing in the country. The women or the young girls and the young women, they are actually, they are more obese. And obesity can be correlated well with that of the PCOD.
Okay.
And that's how these are the hormonal imbalances, and the woman is really suffering with the irregularities in the periods, or there can be acne, or there can be infertility because of the PCOD.
Okay, so obesity is one major concern here.
Yeah, it is one major concern. I just want to make out one point here.
Yeah.
I think recently it's important that looking at the PCOD, there can be menstrual irregularities. And it is only when the patient goes for the infertility checkup, then she comes to know that she is having endometrial cancer. So endometrial cancer, in fact, is the disease of the postmenopausal age group. But because of the PCOD, persistent PCOD, which has not been treated, can give rise to the you can say the proliferation of the endometrium to that extent that it becomes a cancer.
Okay.
So I think it has to be investigated very well.
Right. Early detection and
Yes.
investigation, in
Yes.
fact, is very important in these cases. Also, leukorrhea. Is it a serious health concern for women? And what is it? I would like you to inform.
Leukorrhea can happen even in the normal.
Okay.
It can be normal also. Normal means it is a watery discharge, and it can be more towards the whitish. And this is the physiological, you can say, the discharge, which is important for cleaning, self-cleaning of the vagina itself.
Okay.
And also the moisture in the vagina. These two are very, very important. But when it becomes abnormal, that means if there is any kind of the udder, or there is a change in the color of the vaginal discharge, it becomes, say, reddish in color, or it is otherwise greenish or bluish in color, sometimes because of the infection of the vagina. That means it is abnormal. Okay. But if it is reddish in color, that means one has to really get some kind of the warning sign. It can be because of the problem other than that of the infection, and that can be maybe the cervical cancer.
Okay.
Or if the patient is, or if the woman is in the menopausal age group, then it can be because of maybe some kind of the uterine problem, or the uterine cancer requires to be excluded.
Right. Also, ma'am, fibroids. Many women are coming forward with these cases. But does having fibroids always mean surgery is required?
No, it is not so. It depends on what is the size of the fibroid, where it is located, and also what is the age of the patient. Until and unless these are the large fibroids, right, and giving rise to that of the pressure symptoms, or they are the cause of the excessive, you can say, the bleeding. That depends on the location of the fibroid within the uterus.
Okay, so
And
the location defines what kind of treatment will go, and it's not always surgery.
Yes.
Now, moving on to cervical cancer and the HPV vaccine, I want you to inform our viewers about, first of all, what is cervical cancer and how common is it among women nowadays?
Yeah. Cervical cancer is when the cancer originates in the cervix. Cervix is the lowermost part of the womb, which projects in the vagina. Then it is known as cervical cancer.
Okay.
And almost in our country, about 127,000 women are diagnosed of the cervical cancer every year. And in about, say, 80,000 of the women, the death is because of this cervical cancer. So that means so many women are dying of this cervical cancer.
Right.
So we can see that how big the problem is in our country. On the other side, this cervical cancer is preventable.
That's a big thing.
Yes.
And does HPV vaccine has a part in it?
Yeah, sure. The HPV vaccine is the primary prevention of cervical cancer, where we can prevent cervical cancer primarily by giving the HPV vaccine. HPV vaccine is the human papilloma virus vaccine. And this is the vaccine against the HPV infection, which is the high risk and which is causing the cervical cancer.
And at what age should one person take HPV vaccine? What is the best age for that?
Yeah, best age is ideally the age which is when it is less than 15 years of age.
Okay.
That between 9 to 14 years of the age will be best efficacious. I mean to say efficacy of this vaccine will be the maximum.
Okay.
But it can be given in the women up to 27 years of the age group with almost the similar efficacy.
Okay. And can married women also take this HPV vaccine?
Married women can also take the HPV vaccine. But of course, the efficacy, as I said, when we are giving it before the marriage or before any kind of the exposure to the HPV, then the efficacy is maximum.
Okay.
Even then, it will protect, I think, significantly. As I said, 27 years, these women can be married as well.
Yeah, right.
Now, it is the age group which is beyond 27 years of the age. It can be given to through 27 years to say 45 years of the age group.
Okay.
Now, but
efficacy
here,
gets affected, right?
Here I think there is the efficacy is much less in comparison. Comparatively, it is less, I would say. Should be saying much less, but it is comparatively less. Why it is so? Because these are the women who already must have exposed to that of the HPV earlier.
Okay.
And that is how the coverage given to this group of the patients when we are choosing the vaccine is slightly different.
Right.
As per the recommendation.
Okay. And after taking the HPV vaccine, is cervical cancer screening still necessary?
Yes, I think it's a very, very important question. See, as I said, that when we are giving this vaccine to the young girls who are less than, say, 15 years of the age, this can prevent cervical cancer, maybe, I mean to say, 95% or even more. But even then, there is some chance that cervical cancer may develop. And also, if suppose this vaccine is being taken by the married women, and later on in the age group as I defined, then also there is comparatively some chance of having the cervical cancer. So prevent that, it's important that the cervical cancer screening should be done with the simple pap test or HPV DNA testing.
Okay.
These are the screening tests. Screening test, why we call it as a screening test? It's because when the woman does not have any symptom.
Right.
And she feels absolutely healthy. And that is why there can be a pre-malignant condition, and pre-malignant condition doesn't have any symptom.
Okay.
So actually we can catch them just by doing a simple test of the HPV test or HPV DNA testing, or we can really catch them by PEP test.
Okay. So even having no symptoms could be
Yeah.
a symptom.
Yeah, could not a symptom, but could be a problem.
Problem. Right. And that needs to be screened properly.
Yeah.
Now, moving on, ma'am, lifestyle, it also plays a big role in women's health. So, I want to understand if stress and lack of sleep, does that also affect women's hormones?
Yes, I think if you're coming on to the hormones, yes, I think the stress affects the women's hormones.
It has
Definitely, because melatonin is usually a hormone, right? Which is, I mean to say, can be correlated with that of the stress, and otherwise the other hormones as well, that are reproductive hormones.
Okay.
That is estrogen. So these are all can be affected by that of the stress.
Okay. So, stress does have an impact. Also, ma'am, as we were talking about screening and checkups, what health checkups do you think that women should get done every year?
Yeah, every year the woman should go for the regular checks. That is the clinical evaluation and clinical gynecological checkup, along with that of the breast checkup. These are very, very important. And also one should have the ultrasound every year, ultrasound whole of the abdomen, and also the transvaginal ultrasound to look into the endometrial thickness and also the ovarian status. But at the same time, going ahead with that of the screening test like that of the HPV DNA testing or the PEP test. These are the tests which they should get every year. And also there are some tests like that of the routine tests. These are important. You can just also it is better to evaluate, the blood sugar levels, any kind of the diabetes, or you can say potential diabetes requires to be evaluated better,
Because
so
that
that you
also
can prevent.
has an effect.
One can prevent also the thyroid status, and also vitamin B12 and vitamin D, just to remain in a balanced, you can say, the health. That's how these things are important.
And balanced health also needs balanced diet. I was about to come on that how should women manage their diet for better hormonal health to balance those hormones?
Yeah, I think the diet should be low carbohydrate diet. It should be low fat diet, but it should be high fiber diet and high protein diet.
Any particular fruit or something
Yeah,
that you
I
would
think
recommend?
it should have, rather they should include all green vegetables, green leafy vegetables, and also the fruits. These are very, very important.
Any particular fruit that you would say, is best for ovarian health or reproductive health for women, or any seeds or something like that? Is there anything?
I think papaya is one of the fruits which is really good for the women.
Okay.
And also you can have the pineapple.
Okay.
And I think all whatever the dry fruits, and especially the walnut.
Okay.
So these are, if suppose one is taking care and rather including them, also some of the seeds, I think these are also very, very important.
Okay.
So like turmeric, all those things which are improving the immunity, these things are really, turmeric is the kind of thing which we are using in almost each and everything.
Yeah. Is
So
there in
one
our
can
kitchen almost in every food that we have? So I think it's going to help.
Sunflower seeds, chia seeds,
Okay, so that's
also,
how they also help.
They also help.
Okay. Now moving on to our last segment, which is to bust the myths from the facts and help us divide them, what is true and what is not. So the first statement is, can wearing tight jeans and in fact tight undergarments can that cause infection in women? Is it true or false?
I think it's false.
Okay, it's not true. Okay. Does eating sour food increase bleeding during periods?
No.
Okay, that's also a myth. Should women avoid bathing during periods?
Of course, they should bathe more.
Does PCOS only affect overweight women?
No. They can affect even the underweight women.
Okay. Do papaya and pineapple always harm pregnancy?
No, not at all.
As you said, these are good for our health. Does the HPV vaccine completely eliminate the risk of cervical cancer?
Yes, I mean to say nearly 100%.
Well, that's a great information that you've given, ma'am. And I can say that I got to know, and in fact, our viewers will also get to know a lot of things about cervical cancer, the HPV vaccine, that we have not been able to get the information from other places. And thank you, ma'am, for having us, giving us your time and informing us about all those do's and don'ts for women's reproductive health. And I'm sure our viewers love this conversation. And to our viewers, if you have any questions, then you can leave them in the comment section. And for more such interviews, stay tuned with India TV.